let me express our profound appreciation to His Excellency President Bola Ahmed Tinubu, GCFR, for his foresight in establishing this presidential task force. This proactive decision reflects the administration's commitment to protecting the health and well-being of Nigerians through preparedness, coordination, and timely action. It is always better to prepare before a crisis than to respond after one has emerged. Let me assure Nigerians that there is currently no confirmed case of Ebola virus disease in Nigeria. Let me repeat, no confirmed case of Ebola virus disease in Nigeria. However, recent developments elsewhere in Africa remind us that infectious diseases know no borders. Our responsibility, therefore, is to remain vigilant while providing accurate information that reassures the public without creating any fear or panic. Communication is one of the most powerful tools in managing public health emergencies. Accurate, timely, and science-based information saves lives, while misinformation and rumors can undermine public confidence and hinder effective response. Our responsibility is to ensure that government speaks with one clear and coordinated voice, guided by the Nigeria Center for Disease Control and Prevention, NCDC, the country's technical authority on disease prevention and control. Nigeria approaches this task with confidence, having successfully contained the Ebola outbreak in 2014. That achievement was driven not only by effective medical response, but also by strong leadership, coordinated action, robust resilience, surveillance, and sustained public communication. The lessons we learned at that time remains relevant today. Our assignment, therefore, goes beyond issuing just press statements. We are to develop comprehensive national risk communication strategy that is proactive, transparent, and accessible to all Nigerians, regardless of language or location. I commend the National Orientation Agency for already commencing public sensitization using approved health messages developed by the NCDC. With its nationwide presence across all the 774 local government areas, the National Orientation Agency remains one of government's strongest platforms for grassroots mobilization and public enlightenment. Going forward, we must adopt a whole of government and whole of society approach by engaging television, radio, newspapers, digital and social media, community platforms, traditional and religious institutions, schools, markets, transport unions, women and youth groups, and civil society organizations. The current Ebola outbreak in the Democratic Republic of the Congo remains a matter of serious concern. Latest reports indicate that the outbreak has resulted in approximately 600 confirmed deaths and over 1,700 reported cases, with suspected infections now being investigated beyond the initially affected provinces, underscoring the continuing risk of cross-border transmission. In Nigeria, however, I wish to reassure all citizens, again, there is no confirmed case of Ebola virus disease. Nonetheless, the Nigerian Center for Disease Control and Prevention, NCDC, has assessed the risk of importation as high, given regional population movement and international travels. Consequently, surveillance has been strengthened at our points of entry, health facilities have been placed on heightened alert, and preparedness measures are being intensified across the country. our immediate priorities should include developing a harmonized communication strategy, producing standard public messages, and frequently asked questions. These will strengthen mechanisms to counter misinformation while also translating these communication materials into major Nigerian languages and sustaining regular and community media and community engagement. To support this objective, this subcommittee will develop a unified national risk communication strategy to ensure consistency, clarity, and credibility across all public health messaging. We will harmonize public communication across ministries, departments, and agencies. We will coordinate media engagement and public information efforts and strengthen mechanisms to rapidly detect and correct misinformation and fake news. We will also promote public trust through regular, transparent, and evidence-based communication while ensuring that all communication materials disseminated to the public are technically validated by the Nigeria Center for Disease Control and Prevention, NCDC, which, of course, like I said earlier, is the nation's designated technical authority on disease prevention and control. Above all, our message to Nigerians must remain clear. Again, I repeat, there is no confirmed case in Nigeria. There is no cause for panic. Government is fully prepared and vigilant, and citizens should observe good hygiene, promptly report suspected symptoms to health authorities, and rely on verified information from official government sources. Distinguished ladies and gentlemen, our work is critical to protecting public confidence and strengthening national preparedness. Working together, all of us, under the leadership of the Presidential Task Force that is headed, like I said earlier, by the Chief of Staff to the President, and in collaboration with the NCDC and other stakeholders, I am confident that we will build a Nigeria's proud record of resilience and preparedness. We have done this before. We hope to do it even better this time.